This is day 2 for my client, and we treated her for a pattern called posterior glide of the sacrum, and that is now resolved. She now has good sacral mobility, good spring on the top of the sacrum and good spring at L5, good mobility, inferior glide and superior glide on the left side. But she's complaining of general tightness on this side. She knows her pelvis is off. Is that a fair word?
Yes.
Okay. And what I note, interestingly, it's subtle, but her right PSIS is more inferior. Okay. When I spring the left hemipelvis inferiorly, there is spring. So there's motion translating through the SI into the hip. On this side, I can't even take up the slack. So on the left side, I push to an end point where it stops moving. That's taking up the slack. After that, I do a spring, and it springs downward and recoils back upward. Okay? But on the right side, I cannot even glide it inferiorly. On the left side, I can take up the slack superiorly and spring it, and it springs and it recoils. I see her head bob. On the right side, there's no ability to take up the slack, and I'm increasing the force considerably, and there's no movement. So this is what we call a downslip ilium. And I note that the sacrotuberous ligament feels like bone. I'm not able to give it a little bit of spring. On the left sacrotuberous, there's a little bit of yield, and this is normal. Okay, so we call this a downslip ilium. So my treatment is going to be directed at gliding this ilium up, and I'll teach her self-treatment as well. And you can find some of my other videos on this that show the self-treatment for a downslip. Lie on your back and scoot with your feet down off the table.
Okay.
Okay, lie on your back.
Oh, I'm sorry. What I'm doing.
Okay. And that was on the right side of your body?
Yes.
So what I do is I look for whatever angle allows me to translate vertical force through her pelvis. And abduction doesn't do it, neutral doesn't do it. Most often it's about 10 or 15 degrees of adduction of the hip. There, I get vertical force translation. So I maintain this for 5 minutes. And that's the therapist-directed treatment. And I'll demonstrate the self-treatment on the floor over there for you as well. The self-treatment, the client lies on the floor into a doorway. If it's on the right side, they put their right foot on the wall and the knee points outside of the shoulder. But the secret is you have to be scooted down right next to the door frame so that when you put your foot up, you feel an outward traction through the hip. And you'll notice it's pointing outward, and it mimics that same angle that happens when she's lying on her back. Okay? And this is done for 5 minutes. Lastly, you could wear a yoga strap, wrap it around your trunk vertically, bend forward and snug it up, and then when you stand up, it's shorter circumference than your trunk, and it lifts up through your shoulder. So that's that. I will treat her, and then we'll film her response to treatment.